if you were to look at some sort of a high level treatment algorithm as a guide, like what is that thing that helps you say, yep,
Mm.
100% IBS versus maybe not?
Yeah, and there are those people where you just don't know. I think bloating for me is really important. If they don't bloat, I'm suspicious that it's not IBS. There's bloating, which is what patients talk about, and there's distension, where you see visible distension. Diurnal bloating, going up in as the day goes on and down at night, makes me think if they've got an abnormal bowel habit, we're pretty much home and dry with irritable bowel. If bloating doesn't go down overnight, that's a red flag. That could be something sinister. And the one obviously we worry about is ovarian cancer. I think what people say to me, why do you spend so long with your patients? And I say to them, it's an investment, because I couldn't deal with irritable bowel in 10 minutes because it's just too complicated. And so, but what I say to them is, look, I'll spend an hour with a patient and they probably won't want to see me again, or they may only just want to see me again in a year's time. If you spend 10 minutes with a patient, you'll never get past first base. And then the next time you just get to first base again. And so you never move on. And in the UK healthcare system now, with the general practitioner, it's 10 minutes. And then the trouble is there are groups of general practitioners now. So the next time they go, they don't even see the same doctor.
Yeah.
And so they start all over again. And it's a complete waste of resource, because if that doctor perhaps took 30 minutes or 20 minutes, they'd probably make a lot more progress. And those patients, and the trouble is that the longer the patient's in that system, the more disenchanted they become, the more distressed they become, and more angry they become, then that makes the condition worse. And then they start falling out with their doctors. And, I see patients sometimes, the record is 50 doctors before me, 50 specialists before me. And she was quite a nice person. I couldn't see the problem. We all have a few patients that
Yes.
are difficult, let's put it that way. But she was a delightful person, but she just wasn't getting anywhere. It was quite a complicated story, and you had to spend time. And I saw one yesterday who I didn't think she did have irritable bowel. And I said to her, I'm having difficulty here. I don't think you've got irritable bowel. Endometriosis was the other agenda in her. And I wasn't convinced she had endometriosis either. So I said to her, I don't think this is a gastrointestinal problem, but I'd like to see you again in 6 months in case it morphs into a gastrointestinal problem.
Did you have bloating and mood symptoms like anxiety and not have severe cramping? Like, this is complicated.
Yeah, and I think it's all about the history. And I remember what I was going with is that you're absolutely right. Doctors are becoming more and more specialized. And I often joke there's going to be a doctor for the right arm, and then there's going to be a doctor for the left arm. Quite often gets worse at the time of the menopause. And so I say, look, and quite often patients come back to me and say, you told me I'd get worse at the time of my menopause, and you're dead right. What are you going to do about it? And I said, well, just go on HRT, that's your best chance.